Here we are. Hey, everybody. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. Each week, we will be discussing the hottest topics in veterinary medicine and answering your questions. I'm your host, Mike the Voice Monkey, a full-time professional voice talent and 26-year veteran of the veterinary industry, which, in my opinion, is way too long. But you're not here to hear me talk about myself. You're here to ask our vet. And here's our vet, Dr. Max. Dr. Max graduated from Tufts Cummings School of Veterinary Medicine in 2018 and has been working at the Village Veterinarian in New York since 2020. What is new up there in the snowy New York area?
A lot of stuff. Thanks for asking, Mike, and good evening, everyone who's joined. It's been quite the week here in New York. Crazy blizzard. I don't know how many inches of snow we got, but we did not close.
Wow.
We powered through, and we had a lot of clients who brought in, they came in the crazy weather, brought their dogs and cats to us. I don't know if I would have been quite able to do that myself as a pet parent, but we managed to power through. A couple of vets had to, weren't able to make it in from Brooklyn because they shut down the subway for a little bit. But those of us in the city were able to kind of stick it through and walk our way to the hospital.
So that's the difference between you guys up in the north and us down here in the south. Right. See, we just had the anniversary of the snowpocalypse or the Ice-Mageddon or whatever it was we had down here.
2 inches, or how much did you get?
Well, it wasn't the snow. See, the snow down here is not the problem. It's the ice. And everything, the city sent everybody to school that morning, and they were all in school. I think this is 2014. And everybody went to work. And then about noon, they said, I think it may snow. And then at 2:00, they said, everybody go home. And everybody hit the road all at once. And immediately it was gridlock. The roads were iced over.
Yeah.
I had a coworker that I was working at the vet at the time, and usually takes her about 40 minutes to get home. It took her 12 hours to get home. She actually had to stop for gas on the way.
That's all. That sounds like Katrina. Like when we evacuated New Orleans before Katrina, we went to a small city about 3 hours west. What would have been normally a 3-hour drive west. I think it took us 12 hours. Even when they opened up both sides of the highway with the contraflow. That's insane, though.
Yeah, it was bad. I tried to make it home. I had a 4-year-old at home, and then a new baby at home, or about a year old at home. And I was like, well, I want to get home. I don't want to be stuck here at work. And I left work about 3:00. Made it home, or didn't make it home, actually. I made it back to work about 10:00. And I made it about 4 miles total. And then I had to turn and come back and spent the night at work. There was a restaurant next door which was open. So we got some food, skated across the parking lot, got some food. And then we stayed at work and took care of the patients overnight and slept on the floor and took our 5-hour energies and robbed everybody's lunch pantry in the back. So it's like, oh, somebody left some soup. Desperate times. I didn't make it home.
Desperate times call for desperate measures.
That's right. I didn't make it home till about 2:00 the next afternoon.
I think it's anyone's game. If you're there after midnight and can't go home, I think it's worth it. You got to go for that.
There were 2 of us that got stuck, 2 techs that got stuck, and that was a bonding moment overnight. But it was, there was traffic until at least midnight out on the road in front of our hospital. Just stopped, weren't going anywhere, and people were sleeping in the CVS across the street. And
oh my gosh, this is for one day. This is one night, just because of a little bit of ice on the road.
Well, you can see
not to make light of it.
No, you can see how bad it all goes to hell. So it's or how quickly it all goes, and it's then everybody from up north. We have a lot of northern transplants down here.
Sure.
You go to the Braves games when the Yankees or Mets or Cubs are in town, and there's more obnoxious Cub fans than there are anything else. And they're going, oh, they can't drive in the South. Blah, blah, blah. Well, we don't have snow all that often. Every couple of years we'll have snow. So we're not prepared for that. So get off our back, Yankees.
It is a rarity. I had snow. It snowed thrice in my life in New Orleans. One on Christmas Day, I think I was like in 5th grade or something, and then once for like 2 minutes, also sometime in December. And then I just remember I was in 11th grade. I was in high school, and it started to snow one morning, and we all just started to freak out. And the teachers wouldn't let us out to go play in it. And I'm like, "Are you serious? This is like a once in a lifetime opportunity." And I used my hall pass to go to the bathroom, but I actually went outside to.
I can't believe it snowed down in New Orleans.
It did, yeah.
That's nuts.
Yeah.
That's like when it snows in Florida.
Right. But no, luckily we put salt all over the sidewalk in front of the hospital, and people, were safe. I didn't hear of anyone slipping, and all the dogs, were wearing their little booties so they don't get any of the bad salts. But yeah, it's been an experience, and now it's like all starting. There's still quite a bit left, but it was starting to melt today. So,
do you have any interesting cases this week you'd like to tell the viewers and listeners about? Anything fun or neat, or just something that you would say, "Hey, check this out. This is something happened this week."
Sure. I mean, speaking of pyoderma from last week and all the hot spots, I actually don't have a photo of it on my phone. I thought maybe I had taken one, but I saw a dog with some pretty bad hot spots earlier this week. No ringworm cases, but I guess we'll transition there soon enough. Anything so out of the ordinary? Not so much. I'm kind of thinking just about one of my clients today that's who's been on my mind and just ate up a lot of my time, and tried to kind of change the narrative, because I think she was psychoanalyzing her dog, and we get that sometimes, and I'm sure you've spoken with your fair share of pet owners who anthropomorphize or know exactly what's going on, and so a little bit driving me cuckoo, but I think the dog's just going to be fine, and just had a little bit of upset stomach, but also to note, the owner had been feeding fish stew and some other like a bunch of different proteins from off their kitchen table over the last few days. But anyway, I think that might have been more of the reason for the loose stool, more so than the kids moving back to college, going out of town, and the dog missing them and having stress.
The dog is depressed. Yeah,
that could be part of it. Sure. I can't rule it out. That's but I can definitively say that mixing in different things might be more so a rationale. But
I get that. That.
So just keeping my cool and talking to clients.
I've got a big fat golden retriever downstairs that if she doesn't eat, something's up. And my wife actually changed her food, and she'd go over to the bowl and look at it and then go sit down. I'm like, oh, well, something's, like she'll eat it eventually. But yeah, I went and got her the regular food today, and I put that in her bowl, and she was like, there it is. And so she was thrilled to get back to her normal active maturity food.
Nice.
As opposed to weight loss food. So yeah, but she needs the way. Her name's Lily.
Lily. That's cute.
Yeah, she's a good dog.
Dale was your old golden?
Dale was the old one. Yeah. Lily's the one we adopted her 5 years ago, something like that. She's about 12, and she had a FCE a couple of years ago. Fibrocartilaginous embolism, for anybody who wants to know. Kind of a stroke. Was unable to walk, which is bad when she was 110 pounds.
Yeah.
And but we did rehab on her, and she came through and did fine. So
amazing.
She has a little rear end weakness. Some of that's related to her toenails that need to be trimmed, but she scuffs one of her rear feet when she walks around. You hear her coming. But no, she's a good dog. So I just want to tell people who are watching now, if you guys have any questions, feel free to put them in the chat. If you registered on the Rockwell Pets Pro website, put them in the chat. And we'll answer them. It doesn't have to be about our topic tonight on ringworm. It could be anything you're just curious about. We'll put Dr. Max on the spot and say, hot potatoes. Send them some stuff. But
Send them to me.
speaking of our topic, we had hot spots last week. Skin issues, epidermis. It's like the jokes that kids tell each other. Your epidermis is showing. And you're like, oh, where? Yeah. This week, we're going to talk about another skin condition, ringworm. Is ringworm a worm? That's the biggest question we always get.
It's pretty much the only important one for the evening. Yeah, it's a great question because it really is a misnomer. But to answer it, ringworm is not a worm. It's not going to be any of the, tiny little rice-like worms that you may find, like tapeworms or roundworm. It's not an intestinal parasite, but it is one that can easily parasitize the skin and cause a lot of issues for our dogs. The technical name that we learn in vet school, the official name is dermatophytosis. And it's caused by a tiny little fungus from a couple different genera. So Microsporum is kind of the big one. Trichophyton is another one. And then rarely Epidermophyton, which is a huge mouthful. Most often I've really seen it, the Microsporum, like M. canis or Trichophyton. Those are the ones that kind of we get the fungal cultures back, and they may show those species.
Yeah, I think I had a friend in college that used to drive a tricon back in microtricon.
A microtricon. Yeah. But yeah, I mean, speaking of epidermis, it is really a disease of the superficial skin and hair, and if we're dealing with birds, feathers or horns, claws, it could affect humans as well. We can get to the zoonotic potential there, but nails of our skin, nails of our furry friends. But it's really going to be digesting the keratin in our skin, and with some enzymes that can kind of digest it and destroy it. And it is quite, unlike, parvo, which we spoke about in the first session, it's not life-threatening. Sometimes it's not even itchy, it's not causing any pruritus for our dogs, but it is very contagious and it spreads everywhere. It's like very hardy in the environment. It could last for years. And it's very difficult to get rid of. So there are a lot of,
How do they get it?
How do dogs get it?
Yeah.
Great question. So they get it from just living their lives. It could be out in the soil. So a lot of them are what would be called geophilic. So they really like to live in soil. So, if Lily's outdoors, digging up a pile of whatever she's trying to find or burying a bone. My dog Daisy back in New Orleans, she just goes nuts outside and just kicks up dirt and buries stuff and tries to go build. One time we caught her scratching the grass, creating a little bit of a hole to go underneath the fence to our neighbor's yard.
Of course,
we caught her, so she didn't make it. But anyway, a lot of these species love the soil. They're geophilic. Some are zoophilic, so they're living on animal skin. My dog may get it from our neighbor's dog if they come into contact with each other. So it's really direct contact with an animal or human or fomite, non-living thing on which the organism is on the surface. And so we get on the hair and skin, and really what's necessary. It's not generally going to be affecting healthy skin. It's largely a disease if there's like a little scrape or some sort of defect or wound that it can kind of infiltrate. That's where it's going to set up shop and start asexually reproducing and then growing and they can grow. Yeah.
Okay. What does it look like?
So the ringworm, that's like, the common name that we have for it. It's kind of that hallmark circle lesion that is red and inflamed. And there's usually a bunch of hair loss, because we can discuss kind of how the fungus attacks the hair follicle.
Sure.
But you're usually going to see a lot of scaling and alopecia, sometimes like urticaria or hives. But it's really kind of a hallmark lesion where you see, it's hard for me to describe without like showing a picture of it. But that's like the typical
Paint a picture with your words.
Exactly. Yeah. It's not all, it's, once again, it's a little bit of a misnomer, because you don't always see that typical red ring in dog skin, on dog skin. I've definitely seen it before, but ringworm really can present in a lot of different ways. So sometimes you just see the hair loss. Sometimes you just see scaly skin. Sometimes you see a little patch here, 2 centimeters, up or down the body. You may see more. It can be on the head. It could be on the nose, the ears, the belly, really just about anywhere. It can set up shop. And it can start off kind of a small little patch and then grow and become pretty irregularly shaped. But that's usually, it comes in many different flavors.
Does it generally stay in one spot, or can it spread all around the dog?
It can spread all around the dog, and it can spread to the other dogs you have in the house or the cats you have in the house. So it depends. I don't know if there's a difference between each individual species, like M. canis versus the trichophyton, but it definitely trichophyton. It definitely.
Yeah, I think he wrecked it one time. Yeah, no.
Yeah.
So what does it? You mentioned, what does it do to the hair, like the keratin and things like? Talk about a little more in depth.
Yeah, so it has these cool little, cool for somebody studying microbial pathogenesis or interested in microbiology. It has these cool like keratinase enzymes, which will kind of attach to the hair follicle, and the mycelium, which is kind of one of the functional units of the fungus, will fragment into these little conidia, which has the spores of the fungus around the hair follicle, which may cause that hair shaft to break. And that's why one of the main things that we see is alopecia, the hair loss. And yeah, so that's kind of one of the main ways it goes about doing its business.
So when you have a dog come in, other than the obvious, you see the lesion on the dog, how would you guys diagnose?
Yeah, so definitely, while the gold standard, which we use in vet school, is not just visual observation, definitely important to distinguish potentially, suspect ringworm from other differential diagnoses. So other things that it could be, bacterial infection, for example, like, pyoderma can present kind of similarly. Some of the best tools that we have would be culturing the organism. And there are multiple ways of doing that. I always, if I have a suspicion based on, other pets in the house who may have similar lesions, or if an owner says, my dog has this, and, by the way, I also noticed some redness on my skin and whatnot, any historical findings, I will definitely recommend these tests. And, for unfortunately or fortunately, owners don't always opt to pursue the diagnostic tests. So I'm sure there's a lot of patients that I'll be treating, but it really goes underdiagnosed because we don't, I guess it's, one of the subpar things about veterinary medicine is, most people don't have insurance for their pets. It's
Right.
out of pocket, and if they don't want to, purchase, which can be quite an expensive fungal culture, then we may not know. There are other things, so I can discuss the fungal culture would probably be like the ideal one that I would recommend. It may take some time, even up to a month for certain colonies to grow. There's different media on which they grow. One of them is called the dermatophyte test medium, or DTM. That's the one that I will tell owners, like, that's the one we should do to rule it out. There's also, and I've never known this even from back in vet school, Silberod's dextrose agar.
Oh.
So anyway, they different.
I think I had that for dinner the other day.
Yeah, with your salmon, right?
Yeah.
It pairs well with a nice Chardonnay.
Hey, don't hate me for my lifestyle.
I don't know. Yeah, but I mean, so those are kind of the cultures.
Is that something you do in-house, or is it something you send out?
It can be done in-house. I always recommend that we send it out to a lab, just because there are possibilities for false negatives. And it's the thing, you kind of leave it at room temperature in a locked drawer. I'm sure you may have seen this in practice too. And, you wait a month and there's still no growth, which doesn't really rule out a negative results, unfortunately. The other things that we can do would be one of my favorites, which is a very simple one in-house, called a woods lamp. And so it's kind of the UV light that we shine,
Black light.
the black light, exactly, onto affected area of the skin. And usually, what I learned in vet school, and there's different statistics out there, I don't know if anyone actually knows, but I've learned that 50% of the time it works every time. And so,
Colt 45.
But the thing is, only the Microsporum canis, M. canis, will fluoresce like green, yellow under the black light. But M. gypsium or trichophyton, which we got wrecked the other day, it won't fluoresce. So, there are a couple. I would say the vast majority of ringworm cases in dogs and cats is from M. canis. And so, generally speaking, if you get positive fluorescence, then you can you can kind of establish a diagnosis of ringworm.
What percentage would you say the woods lamp would work on if there is a, you think there's a ringworm case, you bust out the woods lamp and put it on there? How often do you get a positive from that?
Very rarely, honestly. Very rarely.
So the culture is probably the best.
I would say the culture
kind
is
of
the
gold
best.
standard.
And occasionally, and you can do slides to send out for a cytology review that can kind of show the macroconidia. And that would be a way to also distinguish between species of ringworm. But I would definitely go for the fungal culture on the DTM, which is kind of cool because there were times back in vet school and back when in other previous practices I was at before the village vet, where it's a little bit more cost effective to do in-house versus send to a lab, and you can sometimes get growth on the medium. And it's cool because it turns red, which is kind of fun.
Yeah, that's like the little tube or something that's you unscrew the top.
Exactly.
And
You just pluck a couple hairs in the affected area, put it in, and wait. And it may take a week. It may take 2. There's no one. It depends on kind of where from the period of time that the patient had come into contact with the original infection. It usually may take 2 weeks, 3 weeks for any symptoms to be seen. And depending on when during the course of infection it's caught, it may dictate, when it could grow on the medium.
Right, exactly. So
Yeah.
if you've got a client that's maybe cost conscious and just wants to, throw the woods light on there, do a little in-house, or just say, hey, it's probably pyoderma, put them on some antibiotics. You put them on antibiotics, they go home, the dog doesn't get better.
Right.
Because you're not treating
right.
the problem, and then they come back.
Right.
That's another visit, and that's another thing. So pet insurance is very important. I would tell clients they would come in for orthopedic procedures or neurological procedures, and it would be $3,000 or $4,000, and they'd have to stroke that check, and people would always complain. And even in general practice, people would complain about how much it is.
Sure.
And I'm like, well, when you go to your doctor, you got your $40 copay or no copay or deductible, and you're done. Yeah. You don't see the hundreds of thousands of dollars that comes in on the backside of that.
That's true.
So yeah. I've had friends who have had surgeries that they say were $90,000, and then they owed a few thousand for their deductible.
Right.
Whereas if you go in out of pocket, suddenly it's $20,000. You're like, wait a minute, why are we bilking the insurance companies?
It's true. It's very true.
It's bad time. So speaking of treating ringworm, and as opposed to pyoderma, how do you treat it?
Yeah, you can treat it in a number of ways, and I'll tell you, there really is no right way. There's an art to it, because I as a practitioner will speak to my clients about the ubiquitousness of this, this disease. Like, this fungus is going to last for a long time. Like, if we don't treat, which theoretically is an option, just neglect it, but it's not one that I would ever recommend. It may take 4 months or longer for a dog to have his or her immune system, finally clear this. And most likely it's going to spread to other parts of her body, and maybe affect if there are other dogs in the house, including or yourself. So I that's kind of the last option. Although it's not generally going to be itchy or a real quality of life issue here.
Okay.
But I definitely recommend treatment, and it comes in a number of forms: topical, as well as systemic antifungals. And so, we spoke about, treating for antibiotics for pyodermas. That's not going to, unfortunately, fix this. And neither will steroids. I think one of the conversation topics, sorry to jump to that, was about fluocinonide. No. And can it be used for ringworm? And no, it can, but it's not going to help. So I would advise against that. For me, what I generally use for 99% of the patients that I see that have ringworm will be itraconazole. Historically, griseofulvin is an antifungal that there's still no issue in using it. It has good efficacy, but it does sometimes cause some adverse side effects. And I think less so do we see that with itraconazole. I've only used griseofulvin one time back in Louisiana, and I just remember going over possible side effects and the stuff that I learned in vet school. But really, I use itraconazole, or Itrafungal is the brand name, and sometimes up to 6 weeks. So 1 week treat once a day for 7 days, have kind of a rest week, repeat after a week, and kind of go back and forth. I think, you ask one vet, you may get, or you ask 2 vets, you'll get 3 different opinions as to kind of the best frequency and duration of of administering the medication.
And you could ask 3 vets in the same practice, and they would probably
absolutely. They probably would, things. Honestly, they probably would.
Depending on their ages, or where they went to school, or
exactly, for sure. Yeah, and so it's a little frustrating that there's no, and even preparing for this chat, looking up some of the resources that I used in vet school and still do, and drugs and plums and Merck and all these different resources. And there isn't, so much a standard, but, we go with what we've used anecdotally that has worked, and that, I would say our professors and, colleagues have had a lot of success with. And so I think the goal, because it's one of those things where even if you treat for, 6 weeks, you may not have, you may have clinical resolution of symptoms, but if you do another fungal culture, it is possible that, that the dog is still, positive for M. canis. And that at that point, hasn't really cleared it. And you kind of want to go a little bit further, until both clinical resolution and, fungal cultures are negative. I've seen, what I was told is that, you truly haven't cleared it until 2 fungal cultures are negative. No client that I've ever met would be willing to continue treatment until that's the case.
Right.
But that's what I learned in vet school. But theoretically, it's possible that a dog could be an asymptomatic carrier, which I think is kind of one of the, unfortunate problems with, many diseases, including COVID. Is that, like, I've personally been tested 3 times, and thankfully on PCR I've been negative each time. But I wear my mask. I do everything I can to avoid contact and being close to people. But theoretically, like, for those periods of time between being tested, like, I don't know if I'm positive or,
Right.
So it's one of those things with dogs too. They may not have any symptoms at all, but potentially maybe, dispersing this to who knows how many dogs in the neighborhood.
Right.
And so the important thing is, we really want to do the itrafungal, but topical therapy is really, a mainstay too. I feel like I'm beating a dead horse, talking about also with the pyoderma last week, with topical antibiotics versus systemic. But here too, I do think that with treatment, topical is very important and not so difficult. Like, I think back in the day, I've never done this myself, but I know lime sulfur dips. Have you done those?
Yeah.
Yeah. Disgusting, rotten egg smelling. Thankfully
It's
that
yellow.
it's
Yeah.
Thankfully I've never really recommended that. And vast majority of patients do okay with both itraconazole and like miconazole 2% shampoo. And maybe do like 2 to 3 times a week for the first couple of weeks. But really that's kind of good to kind of help with all those hairs that could be falling on the ground. And I did fail to mention shaving a dog is really a good thing to do, kind of shaving all the hairs in that area, because they do contain the spores, and if another dog comes into contact with that, then it could be contagious.
I've done my share of lime sulfur dips in the past.
Did you like them?
No, they're terrible. We had
Did the dogs like them?
No, they're always yellow afterwards, and they stunk.
Right.
We had to wear the gloves, and I would always open the bottle, and if there was somebody new working or younger than me working, I would take it and I'd hold my nose over it like I was smelling it. Oh, it smells great. Smell it. And they would grab it and just shove their nose right in there. And, I gotcha. Now I got to go pour this all over this poor dog. But yeah, I mean, like you were saying about testing, there are false negatives. There could be contamination on the slot or on the culture. Who knows? Somebody may drop it. But it's the same thing with COVID, where you get tested and you're negative. Well, that just means you don't have it at that second you got tested.
Right.
You may be, you may be positive as you're walking home from the doctor's office. It's one of those things to where, people get mad because testing's not more accurate or things are not more uniform across the board. And we're seeing it here where you've got different vets treat different ways. And well, I'm stuck with, there may be an old dude out there doing lime sulfur dips. There may be, somebody doing, they got a huge backlog of ketoconazole, and they're pumping it out there, and they're not doing the newest medication. Or there's somebody on the cutting edge, somebody young like yourself who's out there like, I'm going to go get them. We got to do all this stuff. And people need to understand that nothing's 100% in medicine.
For sure. Yeah.
We're doing the best
perfect
we can.
Absolutely. And it's like one of those things. I saw a dog maybe 2 weeks ago or something. I'm sorry, I know this is dog specific. I saw a cat 2 weeks ago with, a little alopecia just caudal to her right eye, like on the forehead. Owner said it was a little smaller. It had been growing. I knew just by looking at it, I'm like, this is ringworm. I don't know, obviously, but I recommend.
You have a strong suspicion.
Strong suspicion, and we did culture, and it came back negative. So I felt badly, but I also told the owner I still think we should pursue therapy with the ITRA. The itrafungal, and she approved, and the cat has been getting better as she's been giving it. So
that's a tough sell, though.
It is hard to do.
I still think it's ringworm, but the test that I just paid for is negative.
I know.
Well, don't worry about the test you just paid for.
Yeah.
And
sometimes I eat it. Like that was the first time, honestly, in my clinical practice that I have continued recommending something in spite of a negative test. So we're treating kind of without knowing definitively. But I had a strong hunch, and I'm glad it's, I bet correctly. But there have definitely been times in the past for, different pathologies where, I definitely had to, take an L based on something that was incorrect, because, it's difficult with a lot of very similar differential diagnoses. And, you kind of use best clinical judgment along with the diagnostics that we have available. And, I always tell owners that that's the case. Like, we're not going to know for sure, but, we can have a strong clinical suspicion.
You have to use the duck diagnosis.
What's that?
Walks like a duck, quacks like a duck. Probably a duck. So.
Yeah, that's a good one. I was thinking when you were talking about the lime sulfur, I love the smell of pyrantel. I don't know if pyrantel pamoite, dewormer.
I don't think so.
Okay, Lestrangid.
Strangid, yeah.
I don't know. It smells like a banana smoothie. Like
it does. It smells like bananas.
I would drink that any second.
That's what the vets would always say. It's time for your banana milkshake, puppy.
Right.
Into his mouth.
Right.
As he gags all over it. So just want to let people who are watching know, if you want to ask questions, you've registered on the Rockwell Pets Pro thing. I think you have to register to ask questions. If not, just type in a question. It'll show up on the chat here, and we will be happy to answer. It doesn't have to be about ringworm. It can be about old motorcycles that I made up that I used to drive. So it's fine. Whatever you want to do is fine.
Ask me anything. I'm here. I'm ready.
That's right. We talked about shaving the dog because the spores are on the hair. They're contagious. What's the period of time that a dog or a cat is contagious with ringworm? Is it until you get a negative test? Is it 6 weeks? Is there like with the flu? It's you're most contagious before you have symptoms and things along those lines. When are you most contagious with ringworm? Or is it all the time?
Yeah, I mean, you're really most contagious until you culture negative. And is that true negative? Like, as we spoke about. But
right.
that's kind of the thing. You're still capable of shedding. So along with the individual treatment for one animal in the house, which can also potentially extend to other dogs who, if I tell owners we should try to keep them separate, for a couple of weeks, and they're like, that's impossible. And so I tell them, well, it's likely worthwhile to, actually be treating the other dog in the house. And a lot of
Right.
owners get it. A lot of owners say there's no reason, and they kind of like poof poof, like it's not going to happen. And at least I've made the recommendation. And if a couple months down the line, and it may be that may be the case, that the other dog will eventually then start developing symptoms. I'm not going to say told you so, but like that's definitely something that we've seen. I have a dog and a cat. I won't disclose their names, obviously, but same household. Maybe around 2 months ago, I saw them, and we're treating both of them. The owner was very understanding of that, because both of them had symptoms.
Mm-hmm.
But yeah, so trying to keep them separate and quarantined in one area, and really cleaning the environment is a huge one. Like,
Okay.
Speaking about environmental decontamination, dogs who have kennel cough or parvo or ringworm, it's one of those things that is just going to stick in the environment for a long, long time. I think there was a study that shows that it can be surviving like 18 months.
Wow.
Yeah, outdoors. But indoors, if a dog's coming into contact with a surface, it's likely he or she is shedding, and the hairs are going to be containing those spores and be contagious. So bleach is your friend in these cases.
Okay.
And there's like a specific University of Wisconsin put out a specific like 1 to 100, water to bleach ratio.
Mm-hmm.
That can kind of help.
Is that
kill
one
these
water to
spores.
100 bleach? No, I'm just kidding.
Yeah. And then you give that IV, and that'll clear you from COVID, right?
Oh, exactly right.
I'm joking. No,
Yeah,
one.
don't do that. Yeah, no.
Yeah.
Disclaimer: do not listen to Dr. Max when he says inject bleach into your arm.
Clear that from the record.
That's right.
And Fauci would disapprove of me for sure.
Exactly. You tell your dog to wear a mask. So you say the dogs can give us ringworm. People can get it from dogs.
Yes, it's
How
true.
often does that happen? I mean, if you're petting your dog and he's got ringworm, do you actually have? Let me ask you this: do you actually have to pet the lesion, or can you pet anywhere on the dog and get? Because is it on all the hair?
It's a great question. I don't know if I can 100% answer that, because I don't know. But I can tell you that you're definitely susceptible. Generally speaking, people with healthy skin, aren't immunocompromised. They're probably going to be okay, or they could be asymptomatic carriers. And it could easily get on you from obviously touching the lesion. I always wear gloves when I'm suspicious of anything, especially touching the area. But theoretically, those spores, it is one of those lesions that can spread. Usually, I wouldn't say as fast as pyoderma, but can kind of become multifocal and affect different areas. And so, if you are, touching a clean area of the skin, it is possible that it's just hasn't shown yet. But the microscopic spores have already settled around the hair shafts potentially. But yeah, I mean, I don't know also the statistics of, if your dog has it, are you, how likely are you to get it? But we definitely can get it. And so I advise, wash your dog with this topical, miconazole shampoo. Wash your hands every time after you touch your dog. And
Don't
obviously if
sleep
there's
with
any,
your dog. Yeah.
don't sleep, kind of the basic hygiene stuff. And if you have any lesions on your hand or scrapes or, little bumps or anything, pustules, especially don't touch that area of your skin on your dog. Just kind of common sense stuff, but definitely important to be reiterated to people, because if you do get it, I can't treat you legally. I can treat any species but people.
That's
The
right.
Homo sapiens, I legally have to
Oh,
avoid. But so but I always let people know, and people usually understand.
can you
Thankfully,
get?
was
Go
that what you
ahead.
gonna say?
No, go
Oh,
ahead.
I was just gonna say, I've gotten, what have I gotten? I managed not to get cryptosporidium over our like ambulatory rotation with the farm animals on vet school, but I think 9 out of 16 of my classmates got crypto. I'm trying to think of things that I've gotten. I thankfully have not, or I've not been symptomatic for any ringworm in my life, knock on wood.
Yeah.
Um, but and hopefully that will stay the case.
Can you get the shampoo anywhere, or is it just vet only shampoo?
um I honestly don't know, but I imagine it's something that you can only really get from a vet pharmacy, or from the context of your veterinary hospital. But as a prescription, we sell it at our hospital, and I've never had to like write a prescription for it, because owners are very keen on just getting it there on the
Sure.
spot in our clinic.
Sure. I just
Yeah.
wasn't sure if the stuff at the pet store is as effective as it would be through you guys. Like you buy, oh, the antifungal shampoo, but it's not as high a concentration of
Yeah, I
or
would
whatever to
probably
it.
just check the concentration of the, if it's like 2% myconazole, that would be a good one. But that's a good question. Yeah.
So I have a question on here. Does any of this help? Here's a list: apple
Okay.
cider vinegar, oil of oregano, lemongrass essential oils, neem oil, which I don't even know what that is, garlic. It's not a vampire. Or are there any other home remedies you can smear on your dog to make ringworm better, or cat?
I am. I'm not a
Don't make
homeopathic
the
vet.
essential oil people mad.
I'm gonna make the essential oil people mad for sure, and definitely disregard and recommend avoidance of that one, the lemongrass specific variety, or any others. I don't know what neem oil is. Garlic, I would also avoid, especially because we don't want our furry friends to be eating it. I don't know if this would be like rubbing it on the skin or anything, but I don't want garlic to be systemically absorbed and then,
Do you want your pet
destroy
to
the liver.
taste better? Then you put the garlic on them. They taste wonderful.
Um, yeah, I prefer to treat and not to eat.
You should
um,
you should put that over your door to the clinic. We treat, but don't eat.
yeah, I don't know. I've never advocated for any of these, but I don't, I really, my suspicion is that those would not be effective. We really need to get an antifungal long-term, chronic administration of a topical and oral antifungal to truly cure this.
So I looked up neem oil. It's a
Yeah.
vegetable oil pressed from the fruits and seeds of the neem, an evergreen tree which is indigenous to the Indian subcontinent and has been introduced to many other areas of the tropics. So it's a tree in India, I guess. You make neem oil from.
Interesting.
Yeah, probably not the best. But speaking of other treatments, people who are listening, if you go to rockwellpetspro.com and use the code ringworm for $10 off natural dog bone broth with turmeric. Is turmeric helpful for ringworm, or is it just helpful in general?
I think a good anti-inflammatory in general. I don't know if I've not heard it being useful for ringworm specifically.
Let's see. I'm looking
But
at any
apple
other
cider vinegar,
questions.
I'm actually seeing information on University of Wisconsin website. Um, oh, here we go. Natural, in quotation, treatments often suggested on well-meaning pet websites such as apple cider vinegar, coconut oil, tea tree oil, papaya, garlic, grapefruit seed extract, colloidal silver, betadine, and topical bleach are not effective, and some of these home remedies are toxic to pets.
Topical bleach. Oh, poor dogs.
Topical bleach we want to avoid, and then garlic toxic. So
Garlic scented bleach. We definitely don't want that.
There's a
Spritz
reason
onto
why
your
I
dog.
didn't read any of that. We weren't told any of these in vet school because they don't work.
Well, yeah. So is there a way you can prevent your dog from getting ringworm? Besides keeping it away from dogs who have ringworm?
Keeping away from dogs, Bubble Boy, I
Mm-hmm.
think, just staying indoors in a home that has been bleached effectively and decontaminated prior to the dog's arrival. I think there's really no way that I can tell you that you can 100% prevent it. Yeah, I mean, it's just one of those things where it's going to be out in the environment and it's likely going to be on other dogs. If your dog, goes out and, even just for short walks outside and potentially exposed on the grass or soil or other dogs, they're going to be potentially vulnerable to it. There really, as far as I know, isn't a way. There was a Microsporum canis vaccine available in the U.S. That I honestly only found out about through going through one of my syllabi from vet school. But I've never used that, and I've never been in a practice where that vaccine is available. And it was noted that the efficacy was questionable, and there really wasn't any statistics backing that up. But I would say there really isn't any way to prevent it. But just being conscientious and looking for some of the skin lesions that we spoke about earlier in the hour, and trying to catch it early on, and check yourself, check other pets in the household. Those are things to do. And then it goes without saying that if treatment for a month or two is not successful, prior to doing so or along the course of treatment, trying to do other rule outs. Sometimes chronic endocrinopathies, hypothyroidism, Cushing's can show a lot of skin changes, including alopecia, that can kind of mirror, not 100%, but look kind of similar. And it's important to rule those out. So blood tests that can be done with your veterinarian, different ways of going about that. So there really isn't a way to prevent it, to answer your question.
I would say at least keeping their skin healthy would definitely be a way to at least close the door halfway.
Yeah, for sure. Yeah, omega-3 fatty acids, kind of keeps your dog's coat and skin healthy, making sure that, good nutrition, definitely things that reduce the risk, but will not effectively, eliminate the chance 100%. But absolutely, I should have underscored the importance of nutrition, because, healthy skin keeps the doctor away.
Yeah, your overall health. At least it's not a fatal problem. It's just kind of a annoyance problem.
Yeah.
It's definitely. I want to remind everybody again, go to rockwellpetspro.com and use the code ringworm for $10 off natural bone broth with turmeric. I don't think I've ever had turmeric. It sounds delicious though. It sounds like it would be in like Indian cooking or something. Is it? Oh,
yeah.
there you go.
Good. It's so good.
I'm so worldly. So before we wrap up, did you have any other tidbits about ringworm or thoughts about snow or anything else you'd like to share with us tonight, Dr. Max?
No, I mean, it's been great. Do we get any questions?
We haven't had any questions. We've had quite a few people tuning in, but nobody's posting the questions. But yeah, believe me, I would jump on it right away if people were posting the questions. But I don't have a topic for next week. I haven't heard yet what we're going to get into. Hopefully it's something gross and mysterious, to where you mentioned earlier about how, it's interesting to you, the cultures and the the spores and the funguses. And
Mhm.
I think that it takes a certain person in veterinary medicine that appreciates the grossness that we go through. I would regularly gross out my girlfriends and parents when I would come home and say, "Oh, we had this whatever this abscess today that it spewed everywhere and it was gross and it was awesome." And everybody who's not
Yeah.
in the business is horrified.
Yeah. My wife is similar. Like I sent her once what did I say? Just I see so much disgusting stuff on a daily basis, and I sent a particularly nasty pyoderma on the tail of this
Mm.
dog, and she said, like, never again send this to me. Puppies are acceptable, but this is not. So yeah, who knows what we'll get next week down the pike.
They only want the cute side of veterinary medicine, not the
Yeah,
real side.
yeah.
So, all right. Well, we're going to wrap it up here. Thanks, Dr. Max. Be safe. Stay warm up there. Shovel your
Thank
way
you
out
very much.
and have a great week. And we will see you guys next week on Ask Our Vet.
Looking forward to it. Take care, Mike. All right, be well.
See ya.
Bye.